Hello, everyone. Welcome back to another episode of Choose Inclusion for our Black Voices Matter series. I'm joined by my co-hosts, as usual, my wonderful co-hosts, Yubi and Mike. How are you guys doing today?
Doing
Apparently
great,
wonderful.
Nina. Yeah, doing really good.
Cool. Well, I'm excited to have this conversation today. We have today with us the CEO and founder of Spora Health, Dan Miller. Spora Health has a really great mission, and basically what they're doing is they're delivering primary care for people of color. And we're going to talk a lot today about healthcare disparities, the history of healthcare inequality, and a lot more. And so, really excited to have you today, Dan. Dan, how are you doing?
I'm doing well. Thank you so much for having me.
Yeah, so I was wondering if you could just start off by telling us a little bit of background on you and kind of how you got into leading a healthcare startup today.
Yeah, I think the origins of my story really date back to probably my childhood in middle school. Once I'm dating myself here, but once AOL came out, and I was the reason that we got AOL in my household and the internet. And from that point on, I was just hooked. I have a curious mind, and to be able to access endless amounts of information to just learn as much as possible and just follow my curiosity as much as possible is a blessing at that time in my life. And I'm really thankful that I've been able to pursue a career, starting with that sort of emotion and personality. And so I started my career about 12 years ago in startups, and mostly in research design and product roles. But I've also been an entrepreneur for the last 7 years. And I started 3 companies over that time period, and have generally started companies around solving problems that I've experienced. And so the very first company was a company called Fresh Sessions, which is was a marketplace for musicians to book studio time anywhere. So you could think Airbnb, but for musicians and studios, home studios. And in a former life, I explored being a recording artist, and I grew up playing the alto saxophone and piano, and was introduced to the operations of the recording industry and saw how archaic it was, and really wanted to create something better for myself, and ultimately ended up creating a business out of that. And the second company was a company called Level Therapy, which is a mental health practice that provides access to therapists through video, voice, and text. And this was a company, again, born out of a problem that I experienced, and that when I was shutting down that first company, I was transitioning to be a caretaker for a family member that was back east, and I lived in San Francisco at the time, and started to experience for the first time in my life chronic anxiety. And again, for the first time in my life, wanted to speak to a therapist. And I used another telemedicine service and had a really off-putting experience, and left that first session feeling more like a number than a person. And instead of going back and booking a second session, I called my would-be co-founder, and we built an MVP over the next few months, and that ended up becoming what is Level Therapy. And this time around with Spora Health, I was really thinking about not just problems that I've had exposure to. I haven't had any acute issues with health inequities and disparities, but I was really attached to looking at opportunities that I was uniquely qualified to try to solve. And the most abundant vision of a problem that I could address is generally healthcare, race-based inequities and disparities. And after speaking with as many people as I could about the issue and the current state of inequities and disparities in the United States, uncovered that primary care is a really good intervention point to start to create some change, start to develop trust with a specific patient population that's been underserved and taken advantage of historically, and actually start to increase access to care and access to quality care. And then from there, we can start to measure positive health outcomes.
Dan, I thank you for all of that. I'm I'm super interested. I want to dive right in because you guys you had was it a soft launch or a hard launch yesterday?
A hard launch. So we had some
Okay.
press published in TechCrunch, and we have a wait list available right now for our practices in Pennsylvania, Tennessee, Florida, and Virginia. Although we'll be rolling out slowly in Pennsylvania initially and bringing on patients shortly at the end of this year.
That's super exciting. And I'd love to dive in and say, okay, so how do you vet out your primary care network? I'd love to know, like, how does, what are you doing that's being super intentional about making sure that equity is part of the equation from the very get-go?
Yeah, so we have created we create a curriculum for all of our providers as onboarding that they'll need to go through to be able to join our practice. And so we're calling this the Spora Institute. And we are creating very specific training modules for very specific competencies that relate to the experience for Black Americans. And so those are things like nonverbal communication, verbal communication styles, things like motivational interviewing, helping our providers understand how to work through trauma-informed care. And these things will allow us to solve for very specific issues that show up in the provider-patient relationship when we're working with Black Americans. And so all of our providers will have to go through this training. We're also making this available externally outside of Spora Health as well, because this is aligned with our mission. And we start with helping our providers understand their implicit biases for different genders and ethnicities. And then from there, we work on helping them go through the training modules. They can connect with one another to discuss different cases that we'll share with them that revolve around very specific scenarios in which inequities and disparities present themselves. But we also aim to create a safe space for them so that they can discuss their experiences with one another. Because after the first year of med school, health equity is largely not a curriculum that is taught. It's not touched in residency largely. And so after that first year of med school, a lot of those learnings end up becoming put in the background, and implicit biases start to present themselves as our providers become professionals, unfortunately.
I mean, I'd like to take a step back and, Dan, I would love for you to explain to our listeners, like, why is there a lack of equity in health? Like, what is the history behind it? What is the experience of Black people as they interact with the healthcare system as it exists today?
Yeah, so the short answer is all the inequities that exist today and the disparities exist today exist because they're products of the design of the system. And that's not to say that acutely that at large the U.S. healthcare system has been designed to continue to take advantage of specific populations. Although there are points in history where that has very intentionally been the case, namely the Tuskegee Experiments, in which the U.S. federal government funded a program to give Black men syphilis to keep tracks of the condition, how it impacted individuals. And so there's a very dark history of the relationship between Black Americans and the U.S. healthcare system. And because of that, there is a lot of mistrust that exists from our community. And it's something that needs to be managed delicately, because these are very real stories that have been passed down internally from families and amongst the community. And for us to begin to change that, we need to identify the root experiences and issues of some of these inequities and start to redesign the system so that we can start to measure if we're doing a good job with specific types of new approaches and solutions. And so that's where we are today. And I think we have a good start to really start to increase engagement and start to head in a direction where we're increasing outcomes for some folks.
Well, I want to and maybe this is just me, but I just think it's fascinating that if we think about it and everything you've just talked about, there has never been equity in healthcare in this country for anybody other than white people, because there's just you had said cultural competency at one point in our conversations. There's that lack. I mean, it blows my mind. Like, if people just sit back and think for a minute and listen to what you're saying, there never has been equity, and there couldn't be, because there was no connection.
Yeah, largely if you're not a white male in the United States, you haven't had access to an equitable healthcare system. Those are the individuals and personas that were designing it. Therefore, that's who the experience was optimized for.
And Dan, in our pre-call, you blew me away with some of the statistics when I was asking, what are some of the statistics out there? And I think it's super important for our audience to understand, this, what you're aiming to solve for has real, consequences, positive consequences on what's currently happening from a percentage perspective. Do you mind sharing some of the numbers that you were sharing with me on, mortality rates and breast, all of those? Do you mind sharing some of that with our audience?
Yeah, absolutely. So they're very stark and attention grabbing for sure. And we'll start with mortality rate. And so if Blacks and whites have the same mortality rate, 100,000 fewer Black folks would die each year. Looking at children with asthma, Black children have a 500% higher death rate from asthma compared to white children. Black women are, I believe it's 300% more likely to die from childbirth than white women. Additionally, Black women, they're less likely to have breast cancer than white women, but they're 40% more likely to die from the disease. And also, aside from these statistics that are attached to conditions outside of the mortality rate, Black Americans also experience something called the weathering effect, which means they get sicker at younger ages, have more severe illnesses, and are biologically aging more rapidly than whites due to cumulative stress. Now, this cumulative stress has been sometimes pointed to and described as generally just living in a racialized society and racism. But we do tend to see higher cortisol levels due to exposure to more stressors that are aligned with living in a racialized society.
Yeah, I mean, I just see this problem is so much bigger than I think a lot of people realize, because I think, the attitude in the US is very much like healthcare is something that is not a right, and therefore, it really is kind of one of those things where if you see inequity in other parts of culture, you're going to see it in healthcare as well. I think one of the interesting things you started hitting on too is just the inherent distrust with the Black community and healthcare. And it immediately popped into my mind was, Henrietta Lacks. And, I'm sure you know about her, Dan, right?
Yeah, absolutely.
But for our listeners and potentially for Yubi and Mike, in case you don't know about her, she was a poor Black tobacco farmer who had her cells taken from her at a medical institution without her knowledge. And this is back in 1951. And those cells were then used to develop the polio vaccine, cloning, gene mapping, in vitro fertilization. Basically, those cells made billions of dollars for the private sector. And she never saw a penny of it. And to this day, her family can't even afford health insurance. They've seen 0 pennies from it. And I feel like that story is just it explains everything about why there's such a lack of, or why there's so much distrust between the Black community and the medical community. How is Spora Health, addressing that? How do you start building trust after hundreds of years of just terrible things?
Yeah, and this is very much an ongoing process that we're being as diligent and thoughtful about as much as we can. But I believe it starts with any other, like how you would, gain the trust in any other relationship. And so first we're setting our intention that is what we want to focus on. And we're creating experiences around that intention first and foremost. And so that's everything from the actual design of the brand, specifically things like tone, how we talk about care in general, how we talk to our members when we're communicating with them. And then we focus on showing up and giving first. We're really aligned with being as accessible as possible. Anyone can text us at any point in time and ask us any questions, although we're not a emergency service. So but aside from that, we will answer general questions about health and wellness. Folks can email us very easily. Once someone's a member, chat is very much a primary function in the experience. And so we want to start normalizing talking about health and wellness and speaking to anyone on their care team, and just generally always having access to the care team, as well as sharing access to one another so that we can start to create enclaves around, working towards very specific health goals, or sharing information that has worked for us to overcome some of the potential social determinants of health that may exist, or just to close some of the health literacy gaps. But on a foundational level, we are starting by that first being our intention, and secondly, showing up and giving first and as much as we can.
How, today is kind of an interesting and historic moment in the middle of a historic moment in this country. But, the Affordable Care Act case is going in front of the Supreme Court with an effort to essentially get rid of it. What are your thoughts on that? And how does that play into what you're trying to do?
Yeah, a removal of the Affordable Care Act is a step in the wrong direction, I believe, categorically. We need to lower barriers of access to insurance, because that is the barrier between folks really accessing who can pay for their health care. In the United States, individuals paying for health care out of pocket is most certainly isn't the norm, and folks are accessing care either through some federal service or directly through their employer. And so all efforts that are increasing friction to accessing insurance, we're heading in the wrong direction, or accessing, decreasing access to insurance, or we're heading in the wrong direction. And so for us, we're continuing to stay the path and making sure that we can support all our members as much as we can. And so for those that are commercially insured, it's very straightforward and similar to how they would access care. They pay their copay, and they would, can join our membership for a $10 monthly fee. For folks that are uninsured, we still have affordable pricing, around $100 per appointment as they need, but they can still access the membership for the $10 per month. However, from a policy perspective, I'm really aligned with the ACA and making sure that we can generally increase the amount of access to insurance at lower costs, because the lower that we can get some of these premiums, the more folks can actually access care, and then we'll start to decrease the overall cost of care per individual in the United States, which is extremely high and varies high quantities from different patient population. But the root of this is that we need to get folks insured and coverage so they can actually start to engage with their primary care providers and other healthcare professionals at a higher frequency before they get sick, so that when they actually, unfortunately, so that hopefully they don't get extremely sick or get diagnosed with some chronic condition that lowers their quality of life and is very expensive, not just for them, but for the healthcare system as well.
So Dan, I'm curious to find out what, this is a question I ask a lot of our guests because, I think the work that we're all doing is in the hope and vision that will be world changing. And, with the success of like the things that you're doing with Spora Health and the massive changes that you're looking to make and care delivery for the Black population, what do you want the world to look like in 20 years?
I'm really aligned with making sure that, again, setting the intention right now for the folks that we're serving, that Black Americans can live healthier, more joyful lives because they have access to care, period, and also access to providers that understand them and want to understand them. And if we can do that, then we'll start to see increases in quality of life. I think people will be obviously healthier, but I'm more aligned with helping individuals really live more fulfilling and joyful lives. And right now, the current manifestation of that is providing better access to healthcare. And so in 20 years, I would like to be able to do that for as many people as possible, in starting with folks that haven't been served directly with their needs in mind. And again, right now, that's aligning with people of color generally in the United States.
Why now? Why do you think like this is like the perfect time? Because I think this year has been a year, and there are certainly there are certainly amazing things that could have only happened this year. Do you believe
Yep.
that as far as what you're doing, this mission, this company?
Mostly, yes. And the reason for pause there is, this could have been launched, really, as soon as we started to see, inklings of telemedicine taking off, which really started, from a consumer perspective, we started to see a lot of segmentation like 5 years ago.
Right.
But what happened this year is really, obviously, because folks were, cooped up in their homes, glued to some sort of screen. And, we didn't really know, the full extent of what COVID-19 was and how it would impact communities and different systems. People were making sure that they were consuming the news. And over time, we were starting to learn more and more that COVID-19 was impacting some of our most vulnerable populations and really highlighting a lot of the inequities that already existed. And because of that, I think and that on top of a lot of the social unrest that was happening around the summer, a lot of individuals decided to act. And I'm really thankful for that, because I think this is a problem that the private sector needs to address. And thankfully, we were one of the companies that's, was in a position to help and partner with some amazing folks so we can, continue to work on this mission. But had, a lot of the events that happened this year not taken place, it would have still been a struggle, specifically kind of the education about how many of these, really what the experience of some of these underserved communities is, why it's really bad for not just obviously them, but generally the US healthcare system, and how providers can help address a lot of these issues. So I'm it's silver lining, but I'm thankful for, how a lot of this year played out, because, I think we're going to come out on the other end having a lot of awareness around some of the really pressing issues that exist within healthcare in ways that we can start to address some of them.
Yeah, no, I couldn't agree more. I think, sometimes we need a good swift kick to, to just start to wake up again. And so, yeah, I agree. I think in a lot of ways, 2020 has given us a few of those. And in my opinion, it's a once in a lifetime opportunity for things to change. Like, I don't know that we'd get another opportunity for another however many years, right? So, I think it's just, I love what you're doing. My wife works in healthcare, and so it's fascinating to hear the business side of things, but then to have this conversation, because at the end of the day, it's like, if people, it's like we talk about when to companies about hiring, right? If candidates can't see themselves represented in a company they want to go work for, they won't go work there. They won't be happy. They won't get what they need to feel like they're seen, valued, and heard. And it's the same thing with healthcare. If a patient, mental health is a great example. If someone can't see themselves represented in a therapist, then how can they truly have like a conversation where that cultural competency is critical?
Yep.
It's just fascinating to me. So it's really cool what you guys are doing. I'm really excited. Are there any types of partnerships that you all are looking for? Mental health centers or things like that?
At the moment, we are looking for partnerships with health systems in those 4 states that I mentioned. Again, they're Pennsylvania, Virginia, Tennessee, and Florida. Okay. And those are the folks that we're interested in partnering with at the moment. Reason being, there are a lot of established systems for accessing care that are already in place, and so it's important to leverage those where we can, and make sure that we are aimed at really working with a lot of the folks that are already doing a lot of great work, and just trying to help them increase their capabilities, and also think about things a little bit differently where it makes sense.
Awesome. Well, we will keep an eye out as well. And, as always, thank you everybody for listening in. These conversations are critical right now, given the trajectory of our country and the conversations that we're having and everything like that. And so thank you all for continuing to listen. ChooseInclusion.com is the place to go for going back and listening to all the other Black voices we've been talking to, and a lot of the other amazing people doing this kind of work. That's really important. So thank you all. Thanks, Mike and Nina. And again, thank you, Dan. Really, really appreciate it.
Thank you all.
Thanks, everybody. Thanks, Dan.